A St. Louis doctor talks about the huge increase she's seeing in pregnant women with COVID. In fact, one BJC hospital reports they had a 5% COVID positivity rate in labor and delivery in May. And then last week, it jumped to more than 20%. High-risk obstetrician Dr. Ebony Carter at Barnes-Jewish Hospital is seeing a frightening trend in women coming in to deliver their babies.
The rate of COVID positivity in pregnant patients admitted to labor and delivery is higher now than it has been at any other point in the pandemic.
Just a few weeks ago, the WashU physician barely saw any COVID cases in labor and delivery. Now, some soon-to-be moms are ending up in intensive care.
The thing that's breaking my heart most recently is a baby is born with a defect or an anomaly or something else is in the intensive care unit. Mom is positive. She can't be with that baby.
Dr. Carter is now having tough conversations with patients. Would they agree to an emergency C-section if the baby is in distress? And who can make decisions for you if you are intubated? Only 22% of pregnant women are vaccinated. Dr. Carter is pleading with her patients that the risks of COVID are far greater than the vaccine.
If you're pregnant and you get COVID, your risk of ending up in the intensive care unit is increased 3 times higher than if you weren't pregnant. Your risk of needing a machine to breathe for you 3 times higher than if you're not pregnant. Your risk of death is 2 times as high. The vaccine doesn't do that to you.
Whitney Schulte of St. Louis got the vaccine after she was 25 weeks pregnant.
I was hoping that the vaccine would but maybe carry over some antibodies to my baby. And I think that there is data that has shown that.
Your child's only shot at having any level of protection into the world that it's going to be born in, that's a world full of COVID, is if you get the vaccine or if you get infected.
Positive moms and their babies are not separated after delivery if neither needs to be in the intensive care unit. The CDC also just came out with new research saying that the vaccine does not cause miscarriage and strongly urges women to get the shot. A lot of people are talking about this right now.
It's a huge talk about, even if you're not in a family or relationship where you're expecting a baby. I've heard it myself.
Exactly.